Hi, this is Cassidy.
And this is Aliana, and we're going to tell you about the symptoms and diagnosis of Alzheimer's. Alzheimer's is a progressive disease and it worsens with time. The first stage is mild. This includes forgetting little things such as names, misplacing objects as seen in the photo. Simple tasks are also made more difficult, and difficulty making and remembering plans. Although these are the most common symptoms, they can vary from person to person. Symptoms affect people in different ways and in different levels.
The next stage of the disease is moderate. Common symptoms are forgetting the names of loved ones, such as a spouse, a child, or a sibling. Another symptom is changes in personality, changes in mood, and changes in behavior. Common changes in behavior or mood are increased anxiety, sadness, stress, anger, and paranoia, as seen in the photo.
The last stage is severe. This includes not recognizing surroundings or not recognizing family. Trouble speaking and eating is also common, as well as issues communicating. The inability to complete basic tasks causes a need for 24/7 care, as seen in the photo.
So, what causes these symptoms? Alzheimer's disease affects the brain structure by causing deterioration of the brain cells. It affects different regions of the brain at different times, slowly causing loss in brain function. Damage to different parts of the brain causes these symptoms. Damage to the hippocampus leads to memory loss and disorientation. It can also cause amnesia and an inability to form new memories. Damage to the hypothalamus results in changes in hormone levels, which can affect hunger, sleep, temperature regulation, thirst, sex drive, mood, metabolism, and growth. Damage to the amygdala results in mood swings, for example, feeling more anger, fear, sadness, or pleasure. Damage to the cerebellum can result in changes in gait, speech, and other motor functions.
Damage to the frontal lobe can affect decision-making, problem-solving, planning, control of impulses and emotions, and speech and writing skills. Damage to the occipital lobe can cause the patient to have trouble interpreting their environment. For example, seeing illusions, having hallucinations, misinterpretations, and misidentifications. Damage to the thalamus results in trouble hearing, seeing, touching, and sleeping, and affects ability to control body movement. And lastly, damage to the temporal lobe leads to difficulty processing sounds, words, and emotion.
All of these parts of the brain can be seen in the photo on the slide. Another common symptom of Alzheimer's disease is dementia. Dementia is a group of symptoms that affects the ability to think and remember, and it interferes with daily functioning, including social skills and judgment. Dementia can result from many diseases, but the most common is from Alzheimer's disease. It accounts for about 60% of dementia cases, which can be seen on the right. The next most common diseases that result in dementia are vascular dementia, Lewy body dementia, frontotemporal dementia.
Some more data points are as follows. 1 of 9 individuals over the age of 65 are affected by Alzheimer's. Almost 50% of people with Alzheimer's are between 75 and 84 years old, which can be seen in purple in the pie chart to the right. Alzheimer's disease accounts for 60 to 80% of dementia cases, as Cassidy mentioned. After diagnosis, patients usually live for 4 to 6 years, but some can live over 20 years.
It's easy to diagnose dementia as it has symptoms that are easily recognizable. However, it's difficult to determine if it's a result of Alzheimer's disease or if it's a different type of dementia. In order to determine this, doctors conduct examinations upon the patient. For example, they review medical history, conduct a physical examination, view brain images, and watch for changes in behavior. In addition to this, doctors administer different tests to see performance of the brain. Some examples are a neurological exam, mental status tests, computerized tests, genetic tests, and laboratory tests.
Thank you for watching.
Bye!